So today I will talk about PV categorization of articles, and I will present the topic through a flowchart that you see now on your screens. And also I will go through the flowchart parallelly with an example. So what does PV categorization mean? It means 4 criteria together in an article. So you look for the 4 criteria in each article. If they are present together in an article, you categorize it as PV. And you screen all the articles in journal issues and pick for reviewing only those that have been defined to be PV. And not PV related articles are not recorded in our system. So let's see first what these 4 conditions are. The first condition or criteria that you are looking for in an article is identified patient or identified patient group. There can be 1 or more individually identifiable patients in an article. Any mark can be identifiable, for example, their age, their monogram, sex, profession, but therapy or a disease as well. And the identifiable patient usually appears as KJ, 50 years old, female patient, so they are most commonly identified by their monograms, by their sex or their age. So what is important here is that the article should have a piece of information or data about the patient that makes the patient identifiable if you get in contact with the doctor who treated the patient. And as for the group of patients, it is identified by the number of patients. For example, a group of 100 patients participated in a study. And if there is no identified patient or identified patient group in an article, then the article is not PV related and you cross it out from reviewing. So let's see it in an example, and I have a poster abstract. As you can see from the title already, it says that it is a case report, but still we need to go and analyze the article. And almost at the very beginning of the article you can find information about the patient, 50-year-old male, conscious, and so on and so on. So we have an identified patient. After we did that, you are going to move on to the second criteria, author's patient. That means that there should be a presumable connection between the patient and the author, because users of our database need someone whom they can turn to for further details about the patients. Or at least it is to believe that if we got in contact with the authors, they would be able to give us more information on the patients. And usually the authors of the articles are doctors who treated the patients, but sometimes there is no connection between the author and the patient, and in that way the author will not be able to share more about the patients. And in this case, the article is crossed out, not PV. And going back to our example, you can see here that author-patient relationship is confirmed by this sentence. We describe our former patient with blood results, clinical examinations, and treatment taken. So this is a confirmation that the authors who wrote, or the author who wrote this article, was actually the treating doctor of the patient discussed in the article. And author-patient relationship is usually recognizable from phrases like these. we describe our former patient, we describe a patient of ours, a patient came to our hospital, or we conducted a study, or a patient was referred to us, and so on. And if you cannot identify a patient-author relationship, then you cannot categorize the article as PV. And if you identify the author-patient relationship as an existing one, then you move on to the third criteria in our flowchart, which is therapy or treatment mentioned. Here you need to check whether a therapy or a treatment has been applied to the patient or group of patients discussed in the article, and you have to identify what type of therapy or treatment that was. If the therapy or treatment applied was one of these 5 here, so this group here on the left: homeopathy, herb, biological, chemical, and therapeutic device, you keep the article among the ones that go for reviewing, because these therapies get something into the body to cure. Homeopathic, herbal, or chemical therapies matter with or without the mention of the brand name. Therapeutic devices, which are, for example, inhalation mask, electrotherapy, insulin pens, in dentistry, for example, filling tools. So therapeutic devices only matter if their brand name is highlighted, if it's given in the article. If only their type, for example, inhalation mask or insulin pen, so if only this is mentioned in the article, this is not enough, and this is not up for recording. Very important, please note that from PV point of view, only the therapy mentioned in relation with the patient or patient group matter. Other therapies besides the patient case history are not to be recorded in the database. If an article does not mention any of the therapies listed in connection with the patient or patient group, the given article is not relevant from PV point of view. And it is also excluded if the therapy or treatment applied was one of these 3 on the right: manual therapy, medicines prepared in pharmacies, and diagnostic devices. For example, under manual therapy, we have therapies used in physiotherapy, gym balls, yoga mats, cupping devices, massage devices, and similar. And diagnostic devices, for example, X-ray or CT or MRI, everything that is used for examination only. So these devices are not getting anything into our body to cure it. So let's see our example. And it was quite easy to find the treatment. And here in the passage treatment, we have 3 substances mentioned: dobutamine, norepinephrine, oxygen. And after you have identified the therapy or treatment applied to be either homeopathy, a herb, chemical, biological, or therapeutic device, then the article is still up for reviewing, and you have to check whether the therapy was mentioned by name or active substance. So now we are here, this step in our flowchart. And that means that the substance name, ATC7 substance, or a brand has to be mentioned to be specific enough to record the item in our config database. In the case of therapeutic devices, the mention only implies recording if it's a brand name. In case of homeopathic, herbal, chemical, or biological medicines, either an active substance or a brand name has to be present with the patient. Of course, if both are mentioned, and both should be recorded on the article datasheet in the software. If just one of them is mentioned, then please don't record the other one in the name of the rule of objectivity. So please have that always in mind. And going back to our example, we have 3 ATC7 substances mentioned here, and this is specific enough to categorize this article as PV related. And if you don't have a specific name of product or ingredient mentioned, then you cannot categorize this article as PV related, and you cross it out from reviewing. Then we move on, and after you have found all 4 criteria, identified patient or patient group, author-patient relationship, therapy or treatment mentioned, and name of product or ingredient was mentioned in the article, then you are going to go back to your patient or patients discussed in the article for a moment and check whether you have an identified patient or identified patient group. If you have an identified patient, then you are going to follow the left branch here, and you are going to categorize this article as a case report. So this is case report. This is going to be corrected, not to confuse it with studies. And if you have an identified patient group discussed in the article, then you are going to follow the right branch of the flowchart. And in that situation, you have one more criteria that has to be met for you to be able to categorize the article as PV related. And this criteria is a mention of adverse events or special cases. Adverse event or special case are equal in importance here, so there should be either one mentioned or the other or both in order to meet our criteria. Please remember that this criteria has to be met only if there is a patient group discussed in the article. Then you categorize the article as a study of a group of patients. If there is no mention of adverse events and or special cases in the article, then the article cannot be categorized as PV related, and it is out from reviewing. Our example is a case report. So we don't necessarily need to have a mention of an adverse event and or a special case in order to record it in Config software. But of course, if we would have an adverse event or a special case mentioned in a case report, we would record it because we have to record it in the software. But I'm talking only about conditions from the flowchart. So we don't need to have a mention of an adverse event and a special case to categorize the article as a case report. This process that I have explained, specifying PV related articles, is the process of reviewing process of analyzing articles. So this is what you are going to do when reviewing an article. That means recording an article in Confit software. What is important here is the therapy, this part here. So the therapy and the outcome of the therapy, this bottom part of the flowchart. I want to show you another example, which is a study. We've seen a case report and I have a study. Comparison of intravenous morphine with sublingual buprenorphine and so on. So you open the flowchart and first criteria you have is identified patient or patient group, and you start analyzing the article. And immediately in the abstract you find some information. You find the number of patients, 90. So you have an identified patient group identified by the number of participants. And also immediately you have 2 ATC7 substances. So you already have 2 criteria from the flowchart method. You have identified patient group and you have some therapy or treatment mentioned in relation to that patient group, and it is named. Those are ATC7 substances. Moving on, I need to confirm whether the author-patient relationship is existing or not. It says here that the research was performed at Cardiac Anesthesia Research Center, Imam Reza Hospital, Faculty of Medicine, and so on, Iran. Corresponding author is one of the authors of this article, and he is employed in that same hospital. And here is his contact information. This part highlighted, I found information that again this study, this clinical trial was performed on patients referred to that same hospital, and they had this orthopedic surgery in that same hospital. And here our authors say that this is their study. So type of fractures included in our study were fractures of the wrist and so on and so on. So all these indicators are telling you, showing you that there is an existing author-patient relationship. So the authors conducted this study. This was their own study. But even if they were not the treating doctors of these patients, of all these patients, you will see later on that they are giving a lot of detailed information about these patients, which tells you that they had access to patients' data. And if we would contact, and we do have a contact of one of the authors, if we would contact the author, he would be able to give us more information about the patients. So here I already have all 4 criteria met. Of course, I need to analyze the article in detail when reviewing, so I'm not going to stop there. Going through the article, I found a lot of ATC substances. So all of the therapies mentioned in relation with the patients discussed in the article have to be recorded. So the therapy applied has to be recorded. Since we have an identified patient group, We need also to check if we have adverse events or special cases mentioned in the article. And yes, as you can see here, in this sentence I found indications that there were some adverse events related to the treatment applied in this patient group. So I'm going to move on, and here in this table you can see frequency of post-operative drug side effects in the patient group discussed in the article. So there were some adverse events: pruritus, nausea, vomiting, and urinary retention. Here again I have identified patient group. I have one more substance. I have a passage that says something about the side effects, so this is important. And here describing the side effects. The rate of itching in the morphine group was higher than the buprenorphine group. There were no differences between the two groups in the incidence of nausea and vomiting, and so on and so on. So this is all very important. Again, to substances applied, therapy applied. And I reached the end of the article. Now, I would like to ask you whether you have any questions.
Yes, I have one.
Yes, go on.
I want to ask you about, you said that this thing for diagnostic is not recorded, but what if we have a contrast medium for diagnostic? When, for example, you use MRI and you use gadolinium and whatever, so should we record that or not? Because it can have a lot of side effects usually.
Yes.
I don't know.
Yes, the contrast medium enters the human body, and it can affect it in a way. So this is important to record as well.
Okay.
Okay. Any other questions? No. Okay. Now what I wanted to show you is where you may find the flowchart and the examples that we went through today. It is in this folder on OnCloud, Confit Local Literature Monitoring, and you all have access to it. Folder PV Training, and in folder Example Articles, Intro Example Articles, you may find these two examples that I showed you today, and in this table there are solutions to these articles. What you need to do now at home is to go through 4 articles and analyze them following this flowchart. And you may find these articles in folder Practice Articles, First Round Practice Articles. And if you open this Excel file, you are going to see this. So you already have information about these articles filled in, so you don't have to write their titles or numbers. What you need to do is to fill in the empty cells. Type, number of patient or study data sheets, adverse reactions, and special situations. Why is it interesting column not necessary to fill in? So you really don't need to write anything there. When it comes to type, this is PV type. So an article can either be a case, a study, case and a study, or not PV. As you may remember, case and study is, for example, when we have patient group discussed in an article, and there is one or even more patients that are identified individually within that group of patients. Number of patient or study data sheets. How many patient data sheets or how many study data sheets would you record in Confit software? Adverse reactions. Here the answer is yes or no. Are there adverse reactions to be recorded? Yes or no? You don't need to list them. But special situations, please do list exact special situations, all of them that you find in the article. And if you find an article to be not PV related, we also ask you, please fill in all these fields just for the sake of practice. So even though you know that you would not record this article in the Confit software, still fill in number of patient or study data sheets, adverse reactions, special situations, just so you practice. After you fill in the table, please send it by email to your country administrators, deadline being Tuesday noon. And after that, you will receive a feedback on your solutions, and after that we are going to have another presentation, advanced PV categorization presentation, and after that you will do more practice articles, but more about it next time in the next presentation. I would also like to remind you to please fill in, always fill in your availability hours in the availability calendar in Confit software. So do it for a week in advance, and the deadline is always Wednesday noon. So for example, next week you are going to fill in your availability hours for the week after next, and the latest you are going to do by Wednesday noon. I'm sure that you already entered your availability hours for the next week, and you did it this week, so that's okay. And I think this is all what I wanted to say. Oh yes, not to forget, there is also one thing, and it is a questions and answers Google Drive document that I'm going to share with you. And during the practice, so during categorizing practice articles, you may ask questions, whatever questions come up, and you may write down your questions in this table, filling in your country or your own name, what feels more comfortable for you, your question, a short description or a quote and a page number related to your question, and the date when you asked the question. The answer and the date of answer you don't fill in, because our medical advisor is filling in these columns. And our medical advisor is answering questions twice a week. So her availability is from Tuesday 6 p.m. Central European Time till Wednesday midnight, and Friday 6 p.m. till Monday. So in these periods of time she is answering questions, and whatever questions she finds until for example, Tuesday 6 p.m., she is going to answer those questions in that period of time.